today we're talking about cybersecurity and how to create a cybersecure environment for healthcare applications. This is the program for today, so I'm telling you the welcoming words. I'll briefly introduce you the HealthHub Finland project and what we're doing and in that project and how we're helping SMEs to improve their digital capabilities. But after that, we have Alpo Värri, research director from Tampere University. I think Alpo, to many people working in healthcare and cybersecurity in Finland, Alpo is known as sort of the guru when it comes to cybersecurity standards in healthcare. So he will be talking about giving you a short intro to cybersecurity and these standards in healthcare. Then we have senior lecturer Katja Varamäki from Tampere University of Applied Sciences with the topic Designing and Implementing Human-Centered Cybersecurity in Healthcare. But before going into the program, so HealthHub Finland EDIH. EDIH is short for European Digital Innovation Hub. So we're one of the more than 160 European digital innovation hubs in Europe. And we all share the same goal. We want to help SMEs and the public sector in improving their digital capabilities. And how we're doing it, we have a range of different services that we offer. So these services are all grouped together or pulled together from our existing partners, which you can see here on the map. So different regional development companies, universities of applied sciences, and then also some healthcare data holders such as the Wellbeing County of Southwest Finland and the Finnish Biobank Cooperative. So we pull in together these services. We have our testing services where companies can come to us and improve their product, do some product development, product testing. Then we have our support to find investment services and then our networking services. And last but not least, we have also health data or help companies getting access to health data. For example, currently at Aurea Clinical Informatics, they're offering synthetic health data for companies that are interested in doing R&D development. And we are most of our services are for free, but in many cases, even the test beds, the R&D environments are heavily subsidized, so even up to 80% of the market price of that test bed. And if you want to know more, just go to our website, healthhubfinland.eu. There you will find all the information regarding our services, contact details, etc., etc. But today, so Alpo, I think the stage is yours. Go ahead.
Good morning, everybody. So I'm Alpo Värri, research director from the Faculty of Medicine and Health Technology in Tampere University. And in this place, I teach standards and regulations in health informatics. So part of the material is from the courses that I actually teach. So what I'm going to cover today is some terminology, then a glimpse into the threat landscape. So what's threatening the health information, then a couple of frameworks which are applied in arranging the protection of health information in hospital environments. Then some information about how standards and certain frameworks can be taken into use in procurement. And then I'm going to list security related standards from the Committee of Health Informatics in International Standardization Organization. So first, the terminology. What is cybersecurity? So the standards help us in making these definitions. So it's safeguarding of people, society, and organization, nation from cyber risks. So what are the cyber risks? They are risks caused by a cyber threat. So what is a cyber threat? It's a threat that exploits cyberspace. So what actually is cyberspace? It's the interconnected digital environment of networks, services, systems, and processes. And then we end up with the definition of cybersecurity, which is now safeguarding of people, society, organizations, and nations from risks caused by threats that exploit the interconnected digital environments of network services, systems, and processes. So one of the purposes of standards is to define terms, what we are talking about. And here we have a definition for cybersecurity. Of course, the purpose of information security in healthcare is to protect the confidentiality of health information, its integrity, and its availability. And that means that the right people have access to unforged personal health information, and the unauthorized people do not have access to this information. So nowadays, all organizations which are connected to the internet are under attacks from the network by various attackers. Sometimes the attackers succeed. Like here, this is the biggest healthcare industry cyber attack ever succeeding, so that in the United States, an organization which held the data of 11 million patients was kind of cracked, and the crackers got a limited set, but anyway, information about so many people. So there are groups and individuals who try to make holes to the firewalls and other protections of hospital organizations. And the personnel is supposed to protect that information. So there are various threats. The data theft is one of them. The criminals steal the data from hospital organizations, and then they threaten to publish it unless money is paid. The money can be paid, but why shouldn't they ask for more money the next time? So it's better not to let them have the data at all. Then when intrusions to the systems happen, the intruders can encrypt the data of the organization and ask for money to return them back to the organization. And in many cases, the organizations notice that there's no alternative but to pay them to get the money back, the data back, but always the data is not coming back. Then there are cases where the data is intentionally destroyed to harm the organization. And then things like disk system failures or network equipment failures can also threaten the access to the health data. Why are these attacks happening? The most important reason is the financial gain. So there are professional cybercriminal gangs who attacked all organizations with automated tools, and where the automatic tools detect a weakness or vulnerability, they try to filter in their own malware there and apply these ransomware techniques to get access to the data and remove the access of the organization. Then there are these political or ideological motives just to harm the trust of the people to the society, to protect them and their data. This can be some kind of hybrid operations working in this area. Then there are these war crimes, disruption of services. Just yesterday, Mikko Hyppönen said that 15% of the attacks globally in the world happen against Ukraine, where the Russians want to harm the Ukrainian society in many, many ways and their information systems. Then there are also insider threats. Curious insiders want to peek into health records of people they potentially know, and the organization should protect against that one also. The last one is mostly in the past. The teenagers were just breaking into systems to see that how they can succeed to do that. Nowadays, cybersecurity is no longer voluntary. The European Union General Data Protection Regulation has been in place for many years already, but what is new now is that European Union countries have to apply the NIS2 directive into their national laws. And in Finland, we have this Finnish cybersecurity law just published in April this year. Then the EU has also other regulation. There is this Cyber Resilience Act, so which requires that the cybersecurity of the products sold in the market must be improved to a sufficient level. And then there are some older Finnish laws, not so old actually, which require the protection of personal health information. And more details related to these laws can be found from the regulations from the Institute of Health and Welfare, Terveyden ja hyvinvoinnin laitos. These are available only in Finnish, so they have requirements what is to be included to the data protection plan of an organization. Then there's a regulation about the classification and certification of health information systems, and then finally requirements for the essential requirements of health information systems. Then how to build these cybersecurity defenses. Most organizations have already some controls in place and they are developing. But the problem is that the cyber attack tools develop all the time. There's a black market for them. One can buy tools and one can also buy cracked computers from the net. And the attacker needs just one entry point to start getting in and then expand their presence in that organization's systems. So organizations need these kind of 360-degree defenses, protection from all sides with technology, processes, but also by training the personnel so that they are aware of cybersecurity. And I'm not going to talk about that side. The second presentation is completely related to this one. And then there are these information security frameworks, which can be applied to get these 360-degree defenses in place. First, there is this United States-based NIST cybersecurity framework. Then there's the ISO 27000 series, which has a little bit different approach. And nationally in Finland, we have the National Cybersecurity Center, which gives guidelines for this. And even more so after the introduction of this NIS2 directive. Now, some of you may want to export your health information system products to United States, and therefore I have some slides about the United States market. There is this so-called HIPAA law established already in 1996, and it has been extended later with the HITECH Act, and all health organizations understand that they have to fulfill the requirements of these two laws. But it's not only the federal laws which cover the whole United States, there are also some state-specific laws which need to be taken into account. And for guidance, there are several approaches. Cybersecurity publications are many, and these standards are very many, but this cybersecurity framework is very well known. An alternative to that is the high trust security framework. Then from the governmental side, there is this organization, Cybersecurity and Information Security Agency, and they give a guidance. And particularly for medical devices, the Food and Drug Administration in the United States has published two documents. The first one, published in 2023, is what the manufacturer of a medical device needs to provide information when they want to get their medical device accepted to the United States market. And the second one is a so-called post-market document, which describes what has to happen in cybersecurity when the device is already in the market, because the devices can have vulnerabilities and the manufacturer has to take actions when these kind of things happen. And then there are various other types of documents from Army and underwriters, laboratories, etc. So the principles of a NIST cybersecurity framework is that one has to identify one's assets. So what information systems do we have? What software is there? What network components do I have? What are the versions of our software and components? And then they need to protect these assets, for example, by following information about vulnerabilities which are related to their own assets, and then the information from the manufacturers of these assets. And then they need to detect the breaches. When somebody has broken in, it needs to be detected by various means. And then there needs to be a response, timely response to the breaches, so that the harm is as small as possible. And when something has been harmed, there needs to be a recovery from these breaches. And the customers in the United States are already used to the practice that a so-called manufacturer disclosure statement form version 2 is filled when the product is delivered to them, so that they know how the security arrangements of that product have been established and how it can be sits together with the other information systems that they have in their organization. Then coming to the ISO 27000 family of standards. This is an alternative to the NIST framework, and let's say that this is probably more applied in the European side than in the United States side. So, and it means that the series explains how the organizations can establish this information security management system that should protect the organization. It's very much applied in many countries, and of course it is maintained all the time. And this is not only theory. For example, the Helsinki University Hospital organizations have obtained this certificate for the 27001 standard because they feel that it gives trust to the customers of the organizations and also to the kind of companies that cooperate with them. So when we are talking about health delivery organizations, 3 ISO standards are meaningful. The 27001 is the kind of requirements how to establish this management system, and then 27002 explains the controls that are applied in this system. Then the last one is how to apply these 2 standards, particularly in healthcare. So this is the contents of the 27001, the requirements they apply to the whole organization. Then the controls, that is a much longer list, so it goes more into details how you need to arrange these protections, for example, segregation of duties, then identity management, monitoring and review of change management, etc. This is not a complete list. I don't have time to go into details here. And then for the healthcare specific standard, it is related to the previous one, and it just adds a little bit more into some places of the 27002 standard. So there's health specific controls, what needs to be added there. Then Traficom in Finland has started to give detailed information about cybersecurity relating to NIS2. So this is a list coming from that direction. And if we dig deeper, for example, into point 4, it gives comes already closer to the technology, what needs to be done. And if when the organizations want to establish the kind of feeling that how well are we doing in protecting our organization, they have this kind of a cyber meter tool which they can use to assess how well they are doing. And when they found that we have weaknesses there, then they can improve, because the idea about these security systems is that there needs to be continuous improvement of the practices. Then going into procurement, because the procurement is the place where the hospital can define what it buys, and it can specify what security features it needs to have in the products that it buys. Later on, it's a bit more difficult to get these features unless they are in the product already in the beginning. And there was this cyber health project that produced this kind of a very detailed checklist of how to address cybersecurity. Then this list is not intended to be used fully in all purchases, but the organization buying should pick up the pieces that are relevant for this particular purchase. And when procurement, one needs to take into account also these requirements of the regulations here. I want to say something about the AI Act also, because if the organization uses artificial intelligence, it needs to have competencies for that. But for the manufacturers of high-risk AI systems, there are these 10 areas of standards that are in the process and coming in a couple of years. And one of the standards here is related to cybersecurity specifications for AI. So there are additional requirements when AI systems are involved. And the European Union is also active in this area. They have this movement now to produce documents. They are sometimes reinventing the wheel, and their approach is a little bit different than in the previous frameworks. Then finally, the list of standards that the ISO TC 215 Health Informatics has produced. Because of lack of time, I do not stop here to anything else but the last one, because that is security risk management documents for manufacturers. It's under development. I'm going to London next week to hear what's the latest development in this standard. You have this list with the slides, so you can check on these later. And if you're interested more about the procurement, there's an event just next week organized by the Cybersecurity Center of Finland, and join that to hear more. Thank you for your attention.
Thank you, Alpo. I see there are no questions in the chat, but if I may, I have one question. So a lot of standards, a lot of information. So if I'm a startup with a medical device, how and where should I get started? The first steps in order to sort of get myself or my product aware of the cybersecurity needs and things that need to be in place.
You need to check what kind of security features your customers need. So you have to respond to the customer needs there, and if the customer needs include the requirements from the cybersecurity law in Finland, you have to fulfill all the requirements there. And for medical devices, it's good to start from the guidelines of the Food and Drug Administration, because they list a lot of features which you should implement into your products. Probably you want to sell abroad also, so having those in place right in the beginning is recommended.
Great, perfect. So FDA and procurement, or the requirement.
Yep.
Thank you, Alpo. Then, if no questions, and if you have still remaining questions, you can add them in the chat. The Alpo is there to answer them. So next, I would ask Katja Varamäki to take the stage.
Thank you, Henrik. Good morning, everybody. I'm also here in Tampere, and It's raining here, so no pressure to go outside. So you get a lot of work done. So there are good points to this kind of weather. Talking about this morning about cybersecurity, and Alpo really excellently pointed out all the regulations and laws and um, that determine our actions. And I will be talking more about the everyday life and maybe the weak links or the weak points where cyber attacks are sort of like feasible. And let's talk about that a little bit. I'm going to share my presentation. Can you see this?
Yes.
Yes, good. So my name is Katja Varamäki. I'm a senior lecturer in Tampere University of Applied Sciences. My position is in the School of Social Services and Healthcare. So we're basically responsible of the training of social services staff, nurses, physiotherapists, midwives, public health nurses, and so on. So quite a big educational area. I'm going to be talking about Kybersote, which is the project I'm working on at the moment, and together with other universities of applied sciences. This is a project funded by Huoltovarmuuskeskus. We'll be talking about that a little bit and in the later about the details of the project. We will start with the background first, and the focus and the sort of like the view is more in the everyday life of people who work in social and healthcare. You know, hands-on every day, what the situations are, and how cybersecurity is sort of like how do you see that, and how does it affect the way people think, work, and consider cybersecurity, right? So Alpo very well described the situation nowadays that cyber attacks have become an international threat to patients' care and safety. We have seen these headlines in the media, both domestic and international. Some of them got a lot of international attention. For example, the Vastaamo case, and it makes you think sort of like where was the leak, or where was the weak point, or what was the cause? Was it the person who had access to the patient data and didn't know what they were doing, or was it a leak in the system or in a firewall or somewhere? So these are all of these should be prevented, and we should be doing actions and taking measures all the time, preventing these attacks. As you can see, there's a lot of even death-related situations when there is no access to, for example, to the database, or nurses don't have wrong information on it, or it's mixed, or you can't trust the information that you're seeing on the computer, or you don't have access to the information that you need to look after the patients. And there are different situations. You can be in a hospital setting, you can be in home care, and you have different devices and which gain access to patient data. So how do you protect that in different environments and different situations? So we need to understand the risks and how a single person's own actions enhance the cybersecurity. And it's like a sort of like thinking about it as it belongs to everybody to take care of their safety. I think there's a lot of thought that security, or especially cybersecurity, is only the responsibility of the IT department. And people rely on that also, that they feel that they don't have enough knowledge or capability to protect the information. But actually the people and their actions are seen as the biggest cybersecurity threat in social and healthcare sector organizations. And there's a lot of lack of knowledge among the personnel. And these are sort of like the ground points where we started gathering information for the project. And according to the Finnish research, only 1 in 5 healthcare staff members is fully confident in their information and cybersecurity skills for their work. So there's a clear need for education there. The good thing is that 84% in this study were interested in additional training in information security, data protection, and cybersecurity. Of course, as users of healthcare services, all of us feel that we need to trust that our information is secure and we're getting the right treatment and based on the right information. And the staff who are looking after us are also looking after the safety. So the risks have been recognized, and I think that this is. I even feel that we're quite late in developing sort of like the skills of the healthcare staff, social and healthcare staff, in different areas. But better late than never. And the aim of this project is to sort of like raise the standards and the skills and knowledge nationally. So anywhere you go in Finland, if you go to care in a hospital or elderly care or anywhere, you will get the same standard treatment, and the staff would have the same understanding. So this still requires years of work. But with this project and the funding, we are sort of like laying the grounds of better education. So there is a need recognized for developing the skills nationally. So there was a research conducted in Finland that there's also big need for continuing education. So we're not just talking about training the future nurses or social workers, but also training the staff in the hospital working at the moment. So we try to get this in line so that the education would continue. First you get your basic education in your, for example, nurses training, and then you continue updating your employer will continue updating your skills and knowledge when you work for the employer. Developing cybersecurity skills is most effective in an interactive, guided, meaningful, and relevant model for the user's operational environment. So based on this, we decided that we will go into the everyday life of the people, the staff working. If you think about the settings, it can be a nurse looking after a patient. How do you work there? You know, the priority is always the patient, and maybe second or third priority is the cybersecurity. But then that needs to be also very higher on the list for the nurse to think about when they're planning their work and recognizing those situations when there could be a threat. And there are recognized problems. For example, the limited interaction between social and healthcare sector professionals and IT management. Basically, it means that they don't really understand each other's work. So if the IT department is sending guidelines and instructions on to update their programs or do certain actions, but the staff's focus is on the patients and the customers at that moment. So they're not paying attention to that. They're not recognizing what is important there. What is the action? What is the consequence if we don't follow these guidelines or rules? So they don't really understand the consequences of their actions, or what they are doing or what they are not doing. So there's the gap. And the IT staff doesn't really understand why the guidelines and circumstances, what are they like, why they are not following the instructions. And it's a matter of communication, but also understanding the everyday situations in the work. So that has been recognized. So it's not enough that you have IT operations and technical controls and guidelines and instructions. The entire staff must be aware and prepared. So we try to sort of like start building the cybersecurity so that it's a part of organizational culture and not just the business of somebody else, and not just the business of the IT department. You can't outsource security to just one department. Everybody involved in the staff who has access to this information needs to be protecting the data and the cyber attacks, the patients from the cyber attacks. So Varamäki has cleared out, this is in Finnish, but 4 categories, like your own cybersecurity way of working to act, and recognizing cyber attacks or malfunctions, or just like acting on strange behavior or strange information, and also the information and knowledge regarding different devices used in the healthcare, and the threats, and also how to act when there is a malfunction or a cyber attack. How do you recognize that? What should you do? How to act, and not just like oversee the whole thing and just continue normally. And then there's a full-on attack in the system. Okay, so that's some background. So this project aims to strengthen the cybersecurity skills of the professionals in social and healthcare, and also increase the collaboration between different professional groups. The main goal is to protect and promote preparedness, service continuity, and patient safety in organizations. We have 2 perspectives. So increasing cybersecurity skills and utilizing cybersecurity models, and secondly, strengthening the collaboration and interaction between social and healthcare professionals and IT management. So these are the 2 main areas. The project started in February 24 and will continue until the end of next year. And so we are actually funded by the Digital Security Program 2030 by a National Emergency Supply Agency, which is Huoltovarmuuskeskus. And also Cybersecurity Center is involved and supporting this project. The implementing universities, Jyväskylä University of Applied Sciences is the main operator of this project. And then we have Laurea, University of Applied Sciences, Turku, University of Applied Sciences, and TAMK, and Tampere, University of Applied Sciences, which I'm representing. And we're working very closely with our partners. At the moment, we have 3 well-being services county on board: Central Finland, Pirkanmaa, and Päijät-Häme. And we're also negotiating with the other well-being county services, because we aim to have more impact on implementing the results of this project in all of the counties, to get more sort of like national impact. So of course, after this project, we might continue with more several more well-being counties, hopefully. Okay, so these are the work packages of the project. I won't go into these in too much detail, but basically what we're doing is we are developing illustrative, thought-provoking tools promoting cybersecurity skills. And they are videos, they are illustrated pictures and situations from everyday life. So very hands-on, the kind of situations you would have normally, like this morning, if I would go and go to a hospital, to a ward, what might happen there? What would be the typical situations? And all of these are developed together with healthcare staff. So we asked them, we have done a survey from the IT departments. What do they recognize are the risk situations, and then what do the healthcare staff recognize as risk situations, or sort of like when you're in a rush, or there's the data, there's some trouble with opening the programs or using the data, or there are different people who are entering the premises and maybe having access to open computers, or using other people's usernames or passwords and things like that. We also aim to develop an innovative role that would be sort of like an advocate for this in the premises. So they would be helping and supporting the staff in everyday operations. We're also building a cybersecurity training package which can be used by the welfare counties, and they can implement it to suit their needs, and or use as they are. And we're providing material for that. And we're also developing the content of those trainings together with them. So basically online trainings that they can use for new staff entering the work, or continuing education for existing staff. Okay, so then thirdly, we're promoting the skills through training and pilot implementation. So we are actually piloting the trainings starting next autumn. We're training the teachers and the staff in universities of applied sciences, and also the staff in the welfare counties. Part of the training is, of course, to evaluate and refine then the training and the information we get from the implementation process, and then develop it further on. Fourth work package is to promote the collaboration and interaction between social and healthcare professionals and IT experts, and this has been done through workshops and recognizing the gaps or the weak points in the information and interaction. This is also still developing, and we have some good results from that as well. And finally, disseminate the project outputs for use of welfare areas. To support dissemination, strengthen the cybersecurity skills and of social and healthcare university teachers. So we want this to be in line. So from the very training of the staff when they enter the work life, so that they would have good basic knowledge and skills and ability to protect the patient data and be aware of cybersecurity threats. This is a picture of the different actions mentioned here. This is in Finnish, but I can explain a little bit. There's a picture on the left side of a survey that can sort of like you can build a picture of what is the knowledge and the skills, and how does your staff feel that their are their skills up to date, or how do they feel about the situation at the moment. We've done some videos highlighting the different risk situations they can use in training, and online training packages they can use, also virtual surroundings and environments where you can train and sort of like recognize different threat areas or different situations when you enter, for example, a patient room or a care facility. Building different roles and bridges between different professionals, creating good sort of like what would describe the role, like building a bridge between different professionals and strengthen their communication and ability to work together. And on the right corner, you have a picture which is like an everyday situation. We have several of these which will sort of like highlight the different roles of different professionals and how they need to work together and how they can improve their understanding of each other's work. In the center, there is always the patient and the patient data and protecting the patient. So the goal is the same, but a little bit different perspective. So this list of the key outputs for this year, some of them I mentioned already in the previous picture. At the moment, we're working on the training packages, the videos and illustrative pictures and everything. They're already done, and cyber agent role has been defined, and those people we are recruiting and they start their training, and in the autumn we will start the training pilots together with the counties, and next year we will develop them more, and then that will be the time. 2026 will be the time when we sort of like go more into different seminars and happenings to promote the results of the project and just share information and the material we have produced in this project. So that's our project in a nutshell, and the website of the project can be found under this name, Cybersote. And then if you want to use a shortcut, you can use this code to enter and find more information and research. So thank you, and if you have any questions, please.
Thank you, Katja. There's a question for you in the chat.
Are there any tools to help personnel feel more comfortable to bring up their own security errors? Yes, this is a good question. We know that hospitals use, for example, HiPro tool for recognizing hazards in the patient care or in the security. For example, if they're giving out a wrong drug or to wrong patient or anything like this. So the tool for this kind of actions would be needed. You're absolutely right. I don't know for sure if any hospital or organization is using this kind of tool already, but it would certainly we have been talking about this, and we have recognized that it should be made sort of like an easy access to report own errors or near miss situations or things like that. So yes, absolutely. But I can't name a tool at the moment. If you know one, please let me know.
What I would add is that also the culture of the organization needs to be such that they are not punishing the person who informs about his own mistake, so that they encourage and thank for informing so that we can improve.
Yeah, exactly. So it's like a more like rewarding these situations when people recognize and report. Yeah, absolutely. It's psychological tools, yes.
So I have a further question to Katja as well. So basically, where do you see that we could sort of apply new technology, or is it just that you need to educate the healthcare personnel or change the culture, or is there room for technology where we could come up with new ideas to improve, I don't know, monitoring someone's screen when they're doing something, or where is there sort of a need for new business or a possibility for new business opportunities? Where do you think?
Yeah, good question. I think that the people who are working I don't have access to the hospital sort of like their the way that they operate. I think that somebody from the IT department of an organization could very well have ideas on this, what would be useful. But I think the different what we are thinking about is different checklist type things or programs, or which would sort of like alert you when you're doing something or before you are doing something, sort of like these security measures that you need to take. It doesn't sound very difficult. It sounds actually very simple to have sort of like forced checklist before you do something or something like that. Well, maybe there's an idea from that could develop something more.
About monitoring the personnel, there is this law about privacy in working life, so that needs to be taken into account when you're planning this kind of monitoring of personal stuff.
So easier said than done.
Yeah.
Do we have any other questions or comments from the audience? Still have a couple of minutes. If not, before ending the session, I really want to thank Katja and Alpo again for your expertise and being able to speak in the webinar. Thank you, and also Business Tampere for helping us to find the right experts to this session. And as mentioned, this is a webinar series, so there's a fifth session coming up. That is scheduled for September. Exact date is not yet known. The topic will be building a private, or somewhere around building private LLM models and chatbot integration in healthcare and into medical and well-being applications. So the registration opens after summer, so stay tuned on our website and on LinkedIn. You can find more information about the registration. But we hope that this is going to be, again, a hands-on tutorial maybe even including a little bit of coding, some general tools that are useful to develop your own LLM models and maybe even integrate them into a chatbot. So stay tuned. This is something quite cool that we've done in the project with our previous customers. So we're hoping to also share this expertise with you. So thank you all. The slides and the video recording will be shared to you after the meeting. And if nothing else, I wish you a really pleasant weekend.